Let's say you have a private duty portion of your home health agency, or let's say you're just a non-medical private duty agency or a non-medical home health. One thing we want to be able to discuss is this. You do not always want to lower your prices. That is not the main solution if there are problems out there. Because no matter what, when you lower the prices, you still have the same type of expenses that you need to do. You need to pay not just your staff, but your office and everything. If you reduce your price, your cost per hour for services, you may put your company at risk. What you need to do is not lower your prices. You actually need to go out there even more, to work harder, to get more clients, to get more patients. That right there is your job, is to get more, not lower, not reduce, not retract. Okay. What you want to be able to do is not lower, but to reevaluate your business. And at the very same time, is take advantage of unique opportunities to be able to market and advertise your company. Remember, guys, it's easier to advertise now that the economy has gone down a little bit. That's because a lot of companies out there have lessened their marketing, have lessened their strategies, right? Their marketing strategies. And by doing that, there are advertising they are advertising lesser, which means more availability in newspapers, online. You can demand lower rates, but understand one thing, demand lower rates from them, but never lower your rates. In addition to that, why would you want to lower your prices? What you need to do is figure out ways that you can actually add more value to your product that is not costly for your company. You want to be able to show these potential clients, show these potential referral sources, these patients, these family members, that the services that you're providing is actually way more than what you're asking for, way more than what other companies can do. What can you add to your marketing, to your products, to your services? Are you offering them video to video chat with their loved ones? Are you offering them medication reminders? Are you offering them telehealth or those emergency response systems? What are you doing right now at this very moment that you can show that your private duty non medical company or a section of your company is actually of a value on what you're asking for? What's the difference between an Apple computer and a Microsoft computer, right? They're both computers, they both go to internet, yet people are more likely going to pay thousands of dollars for an Apple computer, and that's because they give you more, right? More for your money. They give you more, right? So you're able to see why it's worth more to pay extra money. What you need to do is you need to be able to visually see, to be able to assess what are the things that you can add to be able to make your company more valuable, and for potential clients to actually see why they should be paying the rates that you're asking for. Another big problem is that by lowering the prices, we're going to start seeing a lot of cities out there, several states out there that are planning to increase the minimum wage. So imagine this. If you drop your prices to certain clients, they're going to expect those rates. If all of a sudden things change in regards to where you're located, and then all of a sudden you need to start paying your staff more per hour, then you're going to see a big problem. You want to be able to start anticipating that. There's actually a way to find out what the average rates are in your area. And I'll be glad to share this with you guys, this report that is created every 3 years so that you can actually see what the rates are in your particular area, and to know what our people are paying and what other companies are paying. I'm not asking you to charge the highest, but I'm definitely telling you guys not charge the lowest. You want to be somewhere in the middle rate, in the middle. By doing that, you have ways to be able to negotiate yourself and adjust your items. So once again, if you want to be able to get that report, just contact us via email. We'll definitely be glad to be able to share that report to you guys, or at least where to get that, because that's very important, and I'll be glad to be able to share that with you guys on how to be able to obtain that link. I've heard it before where patient family members tell me when I used to market out there for my companies, oh, Michael, ABC Home Health or XYZ is only charging $10 less than what you're charging. One thing I like to make sure I do is tell them is this. Are they licensed? Are they bonded? Have you checked? Guess what? Are their staff trained properly? Are they certified? Are they training them in a monthly basis like we actually do? Are they being offered in services on a monthly basis to make sure that they're up to date and up to par in their training? Are they CPR certified? Countless times, these agencies that can charge the lowest rates, most of the time, are playing in the shady area of things. They're not certified. They're not approved by the state. They don't have insurances. They don't have, they're not bonded. They actually have staff that are not really allowed to work in the United States. What you need to do is I need to be able to explain to them what are they at risk for if they hire a company who's actually not licensed, who's not bonded. You want to be able to educate people that you're talking to. Remember this, they took interest. They already called you. They already agreed to meet with you. The only way that you're not going to be able to get that referral is because of you, because of your referral source or your marketer, your liaison, right? Those are the reasons why, right? People already asked you to come in, people asked you to present, then you're one step closer. You just really need to be able to find the objections that they may have. And that's what we're doing here. It's like one of the main sections in our training is the closing techniques section of our training, the objection handling techniques of our training, the presentation handling of our training. Every part of the whole sales process is such an important thing, from finding the right places, from presenting the best way, how to handle any objections, how to close the deals, and also how to follow up. Those are all vital with your training, and that's why you're watching this video, because this is one of the first steps that you're doing to try to learn and know what you need to do to be able to have a successful agency. So, like I said, don't lower your prices all the way. Never be the cheapest, but never be the most expensive company. I would always, like I said, put yourself right in the middle or the median rates, between median and the highest rates, somewhere in the middle. Then you can adjust your rates and you won't have any problems at all. Okay? So I hope this video helps you guys out. Understand always that home health marketing is easy when you know what you're doing.